Septal bounce and septal shudder are abnormal movements of ventricular septum described in constrictive pericarditis. Septal bounce is also called respirophasic ventricular septal shift. It is an early diastolic posterior motion of the interventricular septum. Septal bounce is a sign of ventricular interdependence noted in constrictive pericarditis. Sign may be seen on echocardiography, cardiac magnetic resonance imaging, and cardiac computed tomography. Mechanism has been studied by simultaneous cardiac catheterization and echocardiography. Septal bounce was the most consistent sign among 39 cases of constrictive pericarditis evaluated by 2 independent observers in a study. Quote-unquote septal bounce can occur in right ventricular pacing and left bundle branch block, but this occurs in early systole and has been called septal flash. Septal bounce occurred in 93% of constrictive pericarditis and 31% of other cases in a study. Ventricular septal shift has been included as one of the 5 Mayo Clinic echocardiographic criteria for constrictive pericarditis. Increased filling of right-sided chambers and decreased filling of left-sided chambers in inspiration causes a shift of the ventricular septum towards the left ventricle. In expiration, increased filling of the left-sided chambers and decreased filling of the right-sided chambers cause a shift of the septum towards the right ventricle. This is respirophasic ventricular septal shift noted due to encasing of heart in a rigid case with fixed volume. It typically needs a 10-beat long 2-dimensional echocardiography or a mode echocardiogram for documentation. A systematic review noted almost universal presence of septal bounce on magnetic resonance imaging in constrictive pericarditis with sensitivity of 90 to 96% and specificity of 85 to 100%. Septal shudder is an abnormal beat-to-beat septal motion seen in constrictive pericarditis but may also be seen in conduction abnormalities and post-operative septum. Septal shudder occurred in 96% cases of constrictive pericarditis and 44% of other cases. Due to lack of specificity, septal shudder was not included in the Mayo Clinic criteria for echocardiographic findings in constrictive pericarditis. Here are the first set of references. Second set of references are here.